All right. Well, welcome folks who are on. We will give just about one more minute until we get started as we're letting people join the room. Thank you, everyone who's on so far. We will get started in just about 30 seconds. And Joe, if you want to pull up the slides now, that's fine. All right, well, I think for sake of time, we should go ahead and get started. I see that we have a handful of participants on. If you have questions as we go throughout tonight's webinar, please feel free to put in the chat box. There's a section, or excuse me, the Q&A section where you can type in your question. We will review those live and answer them live as we go. We also received a few questions in advance for tonight, so thank you for that. And we're also live streaming on a few different platforms, so hopefully folks on social media can see this, as well as Channel 10 and a few other sites. So I will go ahead and get started. My name is Catherine Goodman. I am the Public Relations and Communications Manager for the Blue Ridge Health District. I'm gathered here today with a few doctors from UVA Health who will join us in a moment in talking about an important topic, which is COVID vaccines amongst pregnant women. So we have Dr. Dory, Dr. Matthew, and Dr. Kaufman. We will give a brief presentation for about 10 or 15 minutes to go over the basics on what we want folks to know about vaccines while pregnant. And then we will go into a Q&A session. So folks can ask questions live while we're going today, and we'll be answering the questions that were submitted in advance. You can go to the next slide, Joe. Here's our agenda, just so everybody can see what's coming up. Like I mentioned, we're going to be talking pretty broadly and also in some specific details. So on both ends here, we want to provide broad information and talk specifically about antibodies and the importance and what can happen when we get vaccinated when pregnant. And our goal here today is to really educate folks. So whether it be people who are pregnant or their family members or people who are around them, to educate you to have the best information you can to make a decision to get vaccinated or not. And our hopes is that you will get vaccinated. And we'll go to the next slide, and Dr. Dory will start from here. And Dr. Dory, will you also introduce yourself and share with us who you are and why we're here to talk about this, and go ahead.
Sure. So I'm Dr. Jennifer Dory. I'm a OBGYN at UVA, and I recently had my second kid during this whole COVID pandemic. So this is a topic near and dear to my heart. My daughter is now about 6 months old. So I was in my late second trimester, early third trimester, when the vaccines were just being rolled out. And I tell all my patients this, it was a hard decision about whether or not to get vaccinated. So I absolutely understand personally the hesitation and the worry and just the doubts about both sides of it. There's worries about getting COVID, the virus, and there's worries about the vaccine and doing something that could harm your baby. So when I was first offered the vaccine in December through UVA, I delayed. I waited. I said, I don't know enough about this mRNA thing. It's not one of the, common mechanisms of vaccine to learn about in medical school. It's not a common one that we give in pregnancy. And so I took my time and I really did a lot of learning and a lot of reading and a lot of back to the basics of immunology and research before I made up my own mind. And then got my vaccines in January of 2021 when I was late second trimester, early third trimester at that point. In that process, I learned so much about all of this. And so I'm so happy to share all that with you so you don't have to repeat all that work and go through sort of all the additional information we've learned in the last few months also as things have progressed. So just first, sort of the impetus for this town hall was that at the end of September, the CDC released an urgent health advisory about COVID-19 and pregnancy. In the month of August alone, we had 22 pregnant women in the US die of COVID. And it's an unprecedented number of maternal mortality from a single virus in the US. And while it's possible not all of these were preventable with the vaccine, we now have a lot of good data to show us just how safe this vaccine is. And it is, while it might not 100% prevent you from getting COVID, it's doing a very good job at preventing severe disease. So we are now strongly recommending the vaccine for anybody who is pregnant, who is thinking about becoming pregnant, or who is recently pregnant, postpartum, or lactating. Pretty much anybody in the fertility world should be getting this, and we can kind of go through all the reasons why. Next slide, please. So since in early 2021, January through September, about 22,000 of them have required hospitalization. So about 1 in 6, it's not great. And about 161 deaths have occurred. 22, like I said, we're in August alone, so we're sort of picking up here. And we think that's a couple of reasons. One of the big ones is this Delta variant, this newer one that is just, it's more dangerous and it's more troublesome even to women who are otherwise very healthy outside of pregnancy. Next slide, please. So here's the it can affect you when you're pregnant. You're perfectly healthy outside of pregnancy. Your body is working so hard to build another human being. It's not always the best at taking care of itself. So reasons that people are getting, or types of severe disease, breathing problems that require admission to the hospital, usually related to how much oxygen you have in your blood, and thus how much oxygen you're giving to baby. Admission to the ICU or the intensive care unit, mechanical ventilation to the breathing tube down your throat, and then heart-lung bypass, which is called ECMO, or which is total heart-lung bypass if your lungs just really can't keep up even with that breathing tube, and then deaths as well. So the big thing is you're at twice as high a risk being pregnant of needing one of those interventions: hospitalization, intubation, ICU, or ECMO, and that increased 70% increased risk of death. The UK just released a press release yesterday showing that 1 in 5 of their total population that are on these heart-lung bypasses are pregnant women, and currently they're all unvaccinated. And so it just, even if you are, like I said, totally healthy, it's really important to think about getting this vaccine, not only to protect yourself, but really also to protect your baby. Does a lot of good things for baby, and we'll have our pediatricians weigh in on that too. Next slide. So like we said, biggest pregnancy complications are the hospitalizations and things, but also puts your baby at some risk too. While babies aren't typically getting the virus, a lot of them are having to be born early if you get severe disease. And so it's increasing our rate of preterm deliveries, which can set babies up for not only immediate consequences, but sort of lifelong problems that, again, our pediatricians can touch on later. Increased risk of preeclampsia, which is a high blood pressure condition, which can also lead to early deliveries. And then mother to baby transmission is low, about 1 to 4%, we think, pretty low. More likely, babies are fairly unaffected other than this preterm delivery. Breast milk is not likely to spread the virus, but is likely to spread antibodies, which is wonderful and protective. Same is true though for the vaccine. So you can give your baby all those wonderful protective antibodies, both when they're in the uterus and also through breastfeeding if you get the vaccine. And then other things outside of pregnancy can also increase your risk of severe disease. So if you go into pregnancy with diabetes, with high blood pressure, or with that body mass index, a BMI over 30, we know you're at higher risk of severe disease. Anybody with asthma like me, you're at higher risk of severe disease. And so even the smallest of things can make you higher risk, unfortunately. Next slide. I think we're transitioning over to Dr. Matthew now.
Yes, thank you. Hi, my name is Irene Mathieu. I am a general pediatrician at UVA, and I work in the outpatient world. So I'm in clinic taking care of sick and healthy children, including newborn babies. And like Dr. Dory, I too was pregnant during the pandemic. I have a now almost 4-month-old. And I even remember having this conversation with Dr. Dory because she was one of the physicians who saw me. And like her, you know, the vaccine was available to me in December as a healthcare worker. And I was very hesitant about getting it initially because there was no information. And I ultimately decided to get it. I thought that it was very, very important to protect myself and my baby. And so I wanted to get it, even though we didn't have all of the data at the time. And so I got the vaccine in January and February, the Pfizer vaccine. So that was during my second trimester. And then actually last week, I got the Pfizer booster while I'm breastfeeding my child now. So I'm very happy I made that decision, and I'm happy to answer any questions at the end about that. But I just want to echo what Dr. Dory said, that now, months later, it's great that we have all of this increased data and information that really show how safe and effective these vaccines are, both for pregnant people and for their unborn babies. So some of the things I just want to go over are really kind of how COVID vaccines work and what you need to know if you're considering it. So the vaccine does not contain the COVID virus. It cannot give you COVID. either a live form or a dead form of it. You may know that some vaccines do contain dead forms of viruses, and this is not one of them. The way that it works is it actually trains your body's immune system to fight the disease in case it should come across the actual COVID virus. And they do not affect your genes or change your body in any other way. So I kind of think about it like this. The mRNA that's in the Pfizer and Moderna vaccines, which you may have heard about, is basically a part of the virus DNA. So it can't become part of your own DNA because we have different types of genetic material. And so what it does is it actually sort of is like instructions that tell your body to make the spike protein, which is that typical protein that you see on all those pictures of the coronavirus that make that crown with the spikes on it. And just that little piece, that spike protein, gets your body activated to fight this foreign invader. And so it creates antibodies. And I think about antibodies like little soldiers, kind of like little special forces soldiers that are trained to fight one specific enemy. And that specific enemy is the spike protein on the COVID virus. So even after that mRNA and all of the vaccine components dissolve and leave your body, those little soldiers stick around, and they stick around for months. And in case you get that COVID virus later, they are ready to go and they've been trained up to go. We know now that the really good news is these antibodies, those little soldiers, can actually be shared with your baby through the placenta. And we know all this is the case for many types of antibodies. So if you have had a cold or a flu in the past, or you have been vaccinated against other viruses, those antibodies are shared with your baby through the placenta, and they're also shared through breast milk as well. Next slide, please. So you can see this kind of diagram here in the lower right-hand corner that basically explains how these antibodies cross through the placenta to your baby. And so it's almost like your baby getting that vaccine without having to vaccinate the baby themselves. And they also come through the breast milk as well. So that's really great because that means these newborn little ones are getting some protection. They're not totally defenseless against the virus. And so it's really important that if you are pregnant or lactating, you discuss any questions or concerns that you have with your physician, as I did, and make sure that the people around you are vaccinated as well. We know that it's great if you're vaccinated, but the more people that you interact with who are also vaccinated, the lower the risk of getting the virus, especially for that very highly contagious Delta variant that we've been seeing recently. Next slide, please. So the big question that I hear a lot of people still have is, how do we know that they're safe? So some of you may have heard of vSafe. vSafe is a system created by the CDC to check for side effects and any adverse outcomes as a result of vaccination. I actually registered with vSafe myself after I got my vaccine, and I got these little text messages every week from the CDC asking me if anything concerning was happening with me or with my pregnancy. And so we've been monitoring both pregnant and non-pregnant people who've gotten the COVID vaccines for months now. And we have found from vSafe, as well as other data safety monitoring systems and ongoing studies, that there were no increased risk of either side effects or any risks to the pregnancy or abnormal pregnancy outcomes for pregnant people who got the vaccine. So we saw that pregnant people who got the vaccine were just as likely as anyone else to have the kind of mild side effects that you may be hearing about, such as fevers, headaches, body aches, sore arm, which I did experience. They were very mild and transient and much less severe than getting the actual COVID virus. So because we now have these data available, we as healthcare providers feel very comfortable not only getting our vaccines and getting our boosters, but also recommending that our patients get them as well. And so we now feel extremely confident saying that the benefits of getting that vaccine outweigh any potential risks, because we have not seen any increased risks for pregnant people at this point. And a lot of people, I think, are also concerned about how many people have gotten the vaccine. And we now know that there are over 163,000 participants who have indicated that they were pregnant at the time when they filled out that vSafe checklist. And so we have vaccinated many, many people, many more people than would be in a typical trial. And the scale of this rollout of vaccination, I think, is really incredible and has given us a really high volume of data in a pretty short time period. Next slide, please. So just to reiterate the really important things to keep yourself and your baby protected, we know vaccines are not a silver bullet. It's with in conjunction with everything else we've been using during this pandemic. So continue to wear a mask, continuing to stay 6 feet apart from those who don't live with you, avoiding crowded spaces, particularly as we're going into the winter months and people are congregating indoors more, frequent hand washing, keeping up with your appointments, and getting any routine vaccines, of course, that you need, including flu shot or anything else that may be recommended to you. And that's the end of my slide, so I'll switch off and pass it on to Dr. Kaufman.
Dr. Kaufman, I think you're on mute.
Yeah. And Joe, if you could go back one more slide. Thanks.
So I'm Dr. Kaufman. I'm a neonatologist. I take care of preterm infants and full-term sick infants who need intensive care right after birth or in those first months of life. And my story is about, I don't know, a few weeks ago when I was getting sign out one evening on the 50 kids in the NICU, we also talk about who's in the hospital, who might deliver. And they listed 5 moms who had COVID, who were at various stages of their pregnancy. One was as early as 22 weeks with twins, and the survival for 22 weeks is a group of patients we've just started resuscitating is about 30 to 40%. Then there was another mom who was 27 weeks, another 28 weeks. The outcomes are a lot better then, sort of at 24 weeks, 85 to 90% of kids survive. So survival is much better at 27, 28 weeks. But we're still faced with having to make decisions as those moms needed intensive care. One of the moms needed to be intubated, and we were trying to decide, do we continue the pregnancy? Do we deliver the baby early and take the baby to the NICU? But it's always better to have the baby, continue and get to term in the pregnancy. Then there was another mom who was 30 weeks, another 32 weeks. So it really hit how fast this virus is spreading and getting to everybody, how it's interacting with everyone, and either it's our choice to get a vaccine, and that's how we interact with COVID, or unfortunately, it's going to infect us if we don't have the vaccine. So it seems to be finding everyone, and we can choose to get vaccinated and have control over the situation versus the COVID happening. And when moms do have COVID, and as we mentioned, they're 2 times higher risks of severe infection, needing intensive care, as well as mortality. If the baby does deliver early, and there's 2 reasons they could deliver early. Either mom's so sick, we need to deliver the baby to help the mom's breathing and lung function, or COVID is associated just with preterm delivery, independent of how sick the mom or the pregnant person is. So those are 2 reasons they may need to come to the NICU. And unfortunately, when that happens, the pregnant person needs to be isolated and can't see their baby as well at the time of delivery, which is heartbreaking to everyone, including us, but most importantly, the parents of the baby. So I don't know, we just really wanted to communicate that important point of things, and just the importance of, as people are trying to make decisions, get everyone around you vaccinated who you're interacting with and being with every day.
Great, thank you all. And Joe, we will go to the next slide, please. All right, so this is just a reminder that there are plenty of places around town to get vaccinated. So BlueRidgeHD.org is the website for the Blue Ridge Health District. And we have a variety of vaccine sites listed on our website. We have a number of pharmacies listed that are also providing vaccines. And here are a few sites listed. So UVA Pharmacy, Moby on the Mall is our mobile unit. So that's just an example of one of our mobile sites that we go to. So if you see a big bus around town, it's essentially a small bus with all of the Blue Ridge Health District information on the side. And if you find that and you see it out and about, feel free to stop by and get vaccinated, or to ask our staff questions if you want more information. And then Seminole Square, the Blue Ridge Health District opened a new site in partnership with a number of folks this week on Tuesday at the former Big Lots site in Seminole Square in Albemarle County. It's open Mondays through Saturdays from 10 a.m. until 8 p.m. And there are plenty of walk-ins. So if you change your mind, or if you decide, tomorrow, or if we end by 8 o'clock today, you can run on over there. Or if you want to go tomorrow morning, there are plenty of vaccines available. We're offering Moderna, Pfizer, and Johnson & Johnson there as well at most of our sites. So this is just a reminder of where you can get vaccinated. And then this phone number listed below, the 972-6261, that is the hotline for the Blue Ridge Health District. So if you have general questions there about COVID, if you need resources for testing or vaccines or anything, you can give us a call and we can help you schedule an appointment. And then we've also mentioned throughout tonight, make sure you talk to your providers if you have other questions, but we're lucky to have some providers here tonight. So we are going to go into Q&A in just a minute and help answer some more questions. And I appreciate that folks submitted questions live, and I see a few questions here now. We had a few questions that were submitted in advance that I'm going to go ahead and ask. And so, Joe, you can actually end the slide deck if you want. Wonderful. And so all of our panelists are here. And I'm going to go ahead and get started. We had a couple fertility questions. So before we dive right into all of the vaccines and itself, I'm going to ask about fertility. So Dr. Kaufman, could you talk to us? I know you had shared before this fertility information about how the vaccine does not affect fertility, but I'd love to hear from you if you could share that with this group.
Yeah, and please chime in, Dr. Mathel as well. But right now, we're not seeing any effect on fertility. And I know NPR had an interesting show yesterday, and they've even looked closely at male fertility. And interestingly enough, it didn't decrease male fertility and actually increased some of the sperm motility parameters that they tested. So we're not seeing any negative effect on fertility.
Yep, and I think so. Two important things about the fertility question. One is that it has been a common concern with a lot of new vaccines, particularly GYN-oriented vaccines like the HPV vaccine when it first came out. We got a lot of questions about fertility, and there was no mechanism by which we could figure out that it ever would. But it's one of those things that it's going to take 10 years for us to scientifically prove. The origin, I think, of one of the concerns with this was originally there was some misinformation going around about a protein called syncytin 1, which is a protein that's present on the placenta. And thoughts that the spike protein on coronavirus was too similar to this protein and would lead to antibodies. The little soldiers that Dr. Matthew was talking about attacking the placenta if you did get pregnant, leading to miscarriages or infertility. And as we've now shown, it has not had any adverse effects in pregnancy. It's not attacking the placenta. We've got good data to show that those proteins are actually quite different on a molecular level. So there's no mechanism by which I can come up with that it would impact fertility. And I certainly have plenty of patients who were vaccinated back in January, February, March, who are now presenting with their early pregnancies. We're not seeing a decline in our pregnancy rate. If anything, the last few months, it's just been going up. So I don't foresee any problem with fertility in the short term or the long term. The other thing about some of these long-term effects that people are talking about, I don't think there's ever been a vaccine, and I would love for the pediatricians to weigh in on this, but to my knowledge, and all my reading, there's never been a vaccine that had significant long-term side effects that didn't have significant short-term side effects. And so we're not seeing that many significant short-term side effects, the fever, the sore arm, those little things, but we're not seeing a short-term impact on fertility. So I don't see a mechanism by which we could have a long-term impact on fertility.
I just want to say, to add on to that, it's important to think about what's in the vaccine, which is one of the questions I had when I was considering whether or not I should get it. And so there's kind of two things to consider, especially with these mRNA vaccines, because that's sort of the new vaccine that a lot of people have the most questions about. And the mRNA itself is incredibly unstable. So you may have heard that these Pfizer and Moderna vaccines have to be stored at very low temperatures. And that's because at the temperature of your body, mRNA rapidly dissolves like a melting ice cube, but really, really small. So there's really no way that it could feasibly travel from your arm to your uterus and cause any sort of problem, because it will dissolve before that happens. And then the other thing I did was looked at the other inactive ingredients that carry that mRNA, and they're all very benign, kind of typical things that you would see in IV fluids, or their cholesterols, fats, just sort of carrier particles that are in IV fluids and foods and drinks and things that we come into contact with every day. So unless you have a specific allergy to one of those components, there should be no issue with any of the inactive ingredients either in terms of long-term effects.
This is great. Thank you so much. And I think you actually answered one of these questions about, can the vaccine cause a miscarriage? Dr. Dory, do you want to add any more information on that? I know you mentioned that there's no evidence showing that it will cause a miscarriage. Anything else to add?
So we had a couple small studies early on with 5,000, 3,000 participants, but just a few weeks ago, a huge study, over 100,000 pregnant women followed, who were mixed between vaccinated and unvaccinated, no difference from the background rate of miscarriage in those who were vaccinated in any point in their pregnancy, including those vaccinated in their first trimester, which I know is a concern for some people. So no indications that it's increasing our miscarriage rate beyond sort of, there's always a risk of a miscarriage, unfortunately, in any pregnancy. So no increased risk of miscarriage, but everybody carries a little risk.
Thank you. All right, another question, and this one was submitted in advance. And so Dr. Dory, I'll go to you for this one as well. Is there any risk of adverse side effects for the fetus as there are for adults administered the vaccine, such as myocarditis, blood clots, et cetera?
Not that we've seen. So when we've been tracking, as Dr. Matthew went through the VSafe data and the VAERS data, we're not seeing any increased risk of any fetal adverse events, anything occurring in the pregnancy that's occurring at a higher rate than at the background. So what you remember when we hear these anecdotes, you hear, oh, but my friend had to. A lot of the things that can happen outside. So we compare it always to sort of the background rate. So thus far, we haven't seen any of those things. Could there be a 1 in a million chance? Sure. It might take us a little bit longer to pick up on those things. So I'm never going to say never, but not that we're seeing. Whereas like we keep saying, the risks of COVID, we are definitely seeing at a much lower rate. So, and that's all of this conversation. And I think everybody I've talked to will attest to this. I kind of always go back to the known and the unknown. There are always going to be things we don't know until we have more people, until we can understand the human body better. But what we know is the risks of COVID. And so when you're making this very personal decision for both you and your baby, come back to what we know the risks are versus what the scariness of that little bit of unknown. And that's what really swayed me to eventually get the vaccine, was when I felt like the risk of the known suddenly became so much greater than the little risk of the unknown.
Like how you explained that. And I also think that helps to answer some of the questions that we received in advance about, should healthy pregnant women still get vaccinated? So folks who aren't high risk necessarily, and it sounds like yes, for those risks that we know, for the known versus the unknown. So thank you. All right, a few questions have come in about the specific vaccines themselves. So one person did ask about booster shots. And so I will at least say on behalf of the health department, we are keeping a close watch on Johnson & Johnson and Moderna boosters. There should be a decision made by the end of next week on those booster shots. So we will certainly let the public know. But one of the questions we received is that, should a pregnant woman receive a booster shot? And I see some shaking heads, but is one of the doctors able to answer that too?
Absolutely. So under the current recommendation, get a booster category, but is under the may get a booster category. So it is certainly reasonable. Pregnancy, as we said, puts you at a higher risk, especially if you're pregnant and you have any of those other conditions we know makes you higher risk. And not only pregnant, but immediately postpartum as well. So if you're in the postpartum period or lactating, you also fall in that higher risk group. So you should be eligible as well.
Great. And then another question along the lines of the vaccine and getting this during pregnancy. There's a couple questions about which vaccine do we recommend that pregnant women get? Is Johnson & Johnson better? Why or why not? Or should they get the mRNA vaccine? And then also, is there a certain time in pregnancy in which people should get vaccinated during their first trimester or later?
So first, to speak to which one, my personal preference is for one of the mRNA vaccines, simply because they have better data, especially against the current Delta variant. They just have a little bit better efficacy. I don't have safety concerns really about the Johnson & Johnson. If your preference is for one shot and done, some protection is better than none, for sure, do it. But we have a little bit more data about the Pfizer and the Moderna for the Delta and some of the newer vaccine or some of the newer variants. As to which trimester, now, honestly, when you can, whenever you can. If you are super anxious and you just are waiting for a certain milestone, if it'll make you feel better to get that first ultrasound, if it'll make you feel better to get to a certain point and you can really isolate until then and have a sort of a protective bubble around you, that's reasonable. But I'd say whenever you can get access to it. We've, like I said, that newer study about with all of the good first trimester data has made me feel a whole lot better about whenever.
And I was just going to add, I mean, the Johnson & Johnson may eventually recommend getting a second shot. And just to also echo the booster, just like we were showing, I know a pregnant person is sharing their antibodies with their baby. So the bigger the boost, you're both getting more protection.
Great, thank you. All right, and then there were a couple questions about flu shots. So I know that individuals can get a flu shot around the same time as a COVID vaccine that is recommended, but how about for people who are pregnant? Do we think that's safe to get both vaccines, even if it's their first vaccine versus if they're getting a second dose or a booster shot?
Sure. So I can speak to that. We recommend getting any of the shots that you need that are recommended, which are typically going to be the flu shot in the winter season, the COVID vaccine if you haven't received it, and most people are also recommended the Tdap vaccine. And then some people may have other additional vaccines they need to catch up on, but those are sort of the typical ones. And there's no concern about spacing them out or getting them on different days. You may have heard that because with some vaccines that do contain live components of a virus or bacterium, maybe if you have children, you've seen that we can't give certain things on the same day, but that's not a concern for this type of vaccine. And again, if you have questions, of course, as always, ask your health provider. They'll be able to give you the most updated information for your specific circumstance, but there's no recommendation not to go ahead and get all of them at once as needed.
Just to clarify, because there have been mixed messages over this, including coming from our office, the recommendation has recently changed. It was to wait 2 weeks in between the COVID vaccine and anything else to reduce the chance of people who had side effects from one or the other thinking it was from both. And so if you're hearing conflicting information, it's probably that it's the recommendation has changed now that we have more information. It's not that anybody is misleading you.
Great, thank you. So folks can come by for a walk-in appointment to get a COVID vaccine and go get their flu shot another day, the next day or later that day. All right, so we have a great question here, and this is for Dr. Matthew. As a pediatrician, what do you recommend I say to a family member who won't get the vaccine but wants to be around my baby? What special precautions should I make them take? I love this question.
That's a great question. And I think that, first of all, I would say as the baby's parent, it is your prerogative to decide who can and can't be around that child. And I would never fault a parent who says, I'm sorry, but I would not like you to spend time with my baby until you are vaccinated. And in fact, you may have heard that for close caregivers, so maybe grandparents or people who are going to spend really close cuddle time with baby, we recommend that they make sure they're up to date on their Tdap shot as well as their flu vaccine. So it's not unreasonable at all to expect that people who will be in close contact with the baby be vaccinated. If this is a case where you feel comfortable waiving that, say it's a really close family member and you feel comfortable taking on that risk, then at the very least that person should be wearing a mask, preferably 2 masks. That greeting should take place outdoors rather than indoors, and minimizing the time that that person is close to the baby as much as possible. So if you can do something from a 6-foot distance, waving rather than kind of up close cuddling. But I think it is completely reasonable and within your right as a parent to make that a hard stop and say, unfortunately, with my baby being this young, until they're, however many months old that I feel more comfortable with this, we're just not going to have unvaccinated visitors. And certainly as things change, you can also change your mind. Feel free to do that. Actually, when my baby was born, we were seeing that lull in the early summer, late spring. And so I felt pretty comfortable with the numbers around that, introducing my baby to many friends and family members in small groups, all of whom were vaccinated. But as the Delta variant started to increase, I started to feel less comfortable. And I said, you know what, we're actually not going to have anyone in the house anymore. We're just going to do outdoor greetings on the porch. And people who cared about me were incredibly understanding and gracious about it. So you should always do what you feel like is right for you and your family, because the last thing you want is a really awkward situation where the person comes over and you realize you feel very uncomfortable, and then you're trying to tiptoe around it, and then you're just really worried the whole time. So definitely do what feels comfortable for you, and talk to your pediatrician if there are specific things about your child or your family situation that may make that a higher risk situation.
That was great. I was just gonna add, it really helps to help push the message for everyone else to get vaccinated, especially if these are, our parents, the grandparents. We want them to be around our kids a long time and not have to face being infected with COVID either.
Thank you. And this is also relatable, as I know the other doctors on here had babies, and I also had a baby in the spring. So I hear you and I feel this, and I love that we're able to talk about this and have so many folks who have joined us and asking these questions. Another question we received is asking about how long is protection with the vaccine? Dr. Dory, do you want to answer that one?
So it depends both on your risk factors and your and your age group, unfortunately. So what we know is that the older you are, the quicker the protection of the vaccine seems to wear off, at least in terms of protecting against severe disease. And then also the more risk factors you have, potentially the faster it wears off, just because you're more likely to have severe disease at baseline. So the recommendations currently are for the booster shot around six months afterwards, if it's been more than 6 months from the Pfizer vaccine. I suspect Moderna will be similar, around 6 months. And the jury's still out on J&J, but I, like Catherine said, I think we're going to get those recommendations in the near future for boosters for those two.
All right, great. Well, I don't see any other questions coming in live. I will give it just another minute and see if anyone adds a question here. I appreciate all the doctors being here to talk about this, and wanted to open it up to see if there's any other information you wanted to share that we haven't already addressed or folks haven't asked about. I think it's the same. We're reiterating, we encourage you to get vaccinated while we're pregnant. The research supports that. We want folks to be safe.
Yep. And I'll just say, I keep talking to people about one way or another, trying to just build a bubble of protection around pregnant mom and baby. And so I think we're targeting moms, because obviously you're the most direct link to baby, but also targeting partners and your other kids as vaccines become available for younger kids, your grandparents, friends, family, nanny, whoever else is in that bubble. Even if you are still on the fence and you want to wait to talk to your own care provider in person, one-on-one, that's understandable, but see if you can't work on getting a little bit more of a bubble, a stronger bubble around both you and baby, as best you can. I am nervous about this winter being similar to last winter, where Thanksgiving and Christmas they're such big gathering times. They're supposed to be fun family times, and unfortunately with winter, indoor gatherings. And really the only way to do that safely and comfortably is with as many vaccinated people as possible. Unfortunately, so many of us are building our families, and we have young kids who can't yet get vaccinated. We have nieces, nephews, and other people who are going to be coming to the house too. And so as many adults as possible getting vaccinated. And as it rolls out for these younger kids too, just trying to gently and politely and comfortably nudge family members and you frame it in a way of protection to protect you and protect baby as best as possible, and get vaccinated so that we can just build those layers around you and keep you safe.
Great. And I did get a couple other quick questions. So one of these questions, and I think this is great, is if a new mom is vaccinated, what is the risk of being around others who are unvaccinated? If she's vaccinated, can you talk to us a little bit about the risk of her getting COVID from someone who's unvaccinated? Any of the doctors?
Certainly. So her risk of severe disease, thankfully, is fairly low if she's vaccinated, and she's been vaccinated in presumably the last 8 months at this point, because that's when most of us are vaccinated. Hopefully that means she was vaccinated during the pregnancy. So baby should also carry some protection. It looks like baby's antibodies, and pediatricians, correct me if I'm wrong, the last thing I read was about 6 months. We think babies still have some in their blood, and they're still getting some through the breast milk as long as you're breastfeeding. And so hopefully mom and baby are both a little bit protected from severe disease. But the question is really the spread and other kiddos in the house. So, I also have my 2.5-year-old. So could he get severe disease? Or could I be passing it to somebody who's higher risk and does get severe disease? So thankfully the vaccine is very protective for you and yourself. But I mean, even myself being vaccinated, I still very much worry about passing it to people who are vaccinated but can't mount a good immune response, immunocompromised people or people who aren't yet vaccinated.
Yeah, I would just echo that, after the baby's born, I know the baby's still at risk of getting, it via respiratory transmission from you if you got infected from a family or friend. So I know it's really important to, really take those precautions. And I think, like we mentioned, if you really need to see those people, see them outside with safe distancing and masking.
Great, thank you. And I think that hopefully, well, we'll see soon if 5 to 11-year-olds are approved to get vaccinated. So for some families that have younger kids around with babies, the health department and other sites will certainly be mass vaccinating that age group, and that should be coming out with a decision in the next few weeks as well. So also an attendee asked about links to support this information. So yes, I will put in the chat in just a minute a couple links. What I really recommend is visiting the cdc.gov website for information about COVID vaccines among pregnant women. They've really compiled a lot of the latest data and information, and then also contacting your OBGYN or talking to your provider, because they'll be able to send you more links and any studies. If you really want to get technical and read any of the research, I'm sure that Dr. Dory or anyone would be happy to share those studies as they're following them very closely, but I'll also put in the chat a couple links.
I would also add to that, look at professional societies. So for example, if you have a question about children, I would go to the American Academy of Pediatrics for the most up-to-date recommendations. Those professional societies are constantly revisiting their recommendations and guidelines based on the current research. Similar with pregnancy. So ACOG, which is the American College of Obstetrics and Gynecologists, as well as SMFM, which is the Society for Maternal Fetal Medicine, both have put out statements that as often as needed, they have revised, kind of summarizing what is the evidence and then what is their recommendation, and providing the links to that information as it's coming out. So I would go to those professional societies and just kind of see what their most up-to-date guidelines are.
Great. And I just was chatting with Abby. She's going to help pull up some of those links, so I will be able to paste them in the chat in just a moment for everybody as well. So another question, I think this is a great thing to really, Dr. Kaufman, you talked about pregnant women that you've treated in the hospital, and folks are asking here, are you treating infants with COVID, and what are we seeing amongst babies?
So I guess the one, good part of the story is the transmission, if someone is infected from mom to baby, is about 1 to 2% during the pregnancy. But after the pregnancy, it's the same as everyone else. And we have seen a lot of kids after the pregnancy get very sick, need to be in the hospital, and, need oxygen and other types of intensive care. And we're still following like the long-term outcomes with kids that like we talked about fertility, that may take several years, but especially with the Delta virus that's out now, I know we're seeing more real systemic involvement with kids, and we're concerned about, long COVID for kids and what it's going to mean for their lifetime.
Thank you. All right, and another one is, how fast do the antibodies build up? And I think this is a great question. We talk about antibodies a lot and the importance of that. Dr. Matthew.
Sure. So they start building up pretty soon after you get the vaccine, but it's important to remember that it takes about 10 days to 2 weeks to really get the full effect of that efficacy. So if you heard some of that initial data that the Moderna and Pfizer, those mRNA vaccines are 94 to 95% effective, that's considering 2 weeks after your second dose. So about 2 weeks after being fully vaccinated, whether that's a 2-dose regimen or 1 dose for the Johnson & Johnson, you can consider yourself fully protected. And then as Dr. Dory said, that protection does wane over time, particularly 6 months plus out. So I would still be cautious if you've just gotten vaccinated within that 2-week period, because we have seen reports of people unfortunately getting COVID because they just hadn't built up enough of a response quite yet.
All right, thank you. And then another question again about the booster shots. And I know this is a big topic. So this one is specifically about Pfizer. So if you got the Pfizer and you're pregnant or postpartum, should you get the Pfizer booster? And then I think this might go broadly to when, if and when other booster vaccines are available. And if you can just reiterate, Dr. Dory, you mentioned when people should get a booster shot. Is it just immediately postpartum? Is it 6 months after they've had a baby? When to recommend that if they're still breastfeeding, or what would be the difference?
So ideally, so you're eligible and you're considered still high risk, so you meet the criteria under that 8 to 50-year-old with other significant conditions if you are either pregnant or postpartum. So whenever you hit that six month mark, you would be eligible. The way it was phrased, like, do you have to? No, you don't have to. It's one of those, you may get it. And so it just depends on your level of worry about it. Depending on your age and your other risk factors, you may have longer immunity than 6 months. So it might be reasonable to wait a little bit longer. Remember, if you get the shot and you're breastfeeding particularly, you are going to probably get a boost in your antibodies, and that's a boost in what you pass to baby, which could be a big bonus for baby. But I think this is going to become more like our flu shot, where we end up getting them almost annually or whatnot in the future. But for now, I think when you have time and the access with the Pfizer.
Wonderful. And then another question that came through, and I think this is a really great question as well, is what are your thoughts on natural immunity versus getting the vaccine?
Well, I would say that with natural immunity, so actually getting the virus, you run the risk of death or going into an ICU or having long COVID or these really severe complications. So unfortunately, we can't rely on natural immunity, particularly for pregnant people and other high-risk populations, because we have seen the toll that it takes. Now, if you're somebody who's already had COVID and you have proven, you have the test results that you definitely had COVID, the recommendation is still to go ahead and get vaccinated if you are, I believe it's 90 days out, but correct me if that's other folks, if that's incorrect, if you're more than 90 days out, because we just don't know who is going to have lifelong immunity, immunity for 6 months, immunity for a year, and whose immunity will fade really quickly. And so just to be on the safe side, there's certainly no harm in getting vaccinated after you've already gotten COVID if you're outside of that initial window, just to give yourself additional protection.
Yeah, and just to add to that, I mean, people who have had COVID have gotten it a second time if they haven't gotten vaccinated as well and have gotten sick. So, just like, with most of the vaccines, you need 2 shots. You really need more than just the infection to protect you with COVID.
Great. And what we're doing at the health department, and I believe the guidelines are that anyone, if you've tested positive for COVID, you can get a vaccine anytime 10 days after your positive test with no symptoms, or if you're in quarantine, anytime after quarantine. The 90 days is because there is, hopefully some build-up protection and antibodies that you'll have for those first 90 days. So you can wait up to 90 days after the positive test, but definitely that getting vaccinated is good. And Dr. Dory, I saw you unmuted yourself. Anything you wanted to share there too?
I was just going to say about the 90 days. The only time it should be 90 days if you had COVID. So if you're pregnant and you get COVID, you are high risk, like we said, for severe disease. There are a few things we can do to mitigate those risks. One of which is something called monoclonal antibodies, which we have a program for at UVA. So if you do test positive for COVID in your pregnancy, you haven't had a chance to get vaccinated, or if you are partially vaccinated at that point, you tend to happen to get it. Call us. We can try and set up for you to get something called monoclonal antibodies if you want to reduce the risk of severe disease. Those monoclonal antibodies are similar to the antibodies you would make from the vaccine. And so we think they could impair your reaction to the vaccine. So if you did receive monoclonal antibodies, that is the one time we do recommend waiting the full 90 days.
Great. All right. And then I think we'll go with our last question here is, if your pregnancy is already high risk, does that affect you getting the vaccine?
All the more reason to get it. So if you're already high risk, that means your body is already working overtime, either because of something going on with you or because of something going on with baby. And so there are very few reasons not to get the vaccine for anybody, including pregnancy. One of which is if you have like a known severe reaction to that vaccine. Even that, the people who have known severe reactions to other vaccines or similar vaccines, only about 3% we're finding actually have a strong reaction to these mRNA vaccines. And so our allergists are able to actually help us with some testing for that if you are worried about an allergy to any component of the vaccine. The other beautiful thing about having so many choices of vaccine, you have the mRNA vaccines, the Pfizer and the Moderna, and you also have the Johnson & Johnson, the adenovirus vector vaccine. So typically, if you have an allergy to one, you don't have an allergy to the other for most people. Occasionally, people who are just highly allergic can have ones to each, but that's really the only reason not to. A high-risk pregnancy, like I said, it just means you're at higher risk for severe disease if you get it. And like Dr. Kaufman was saying earlier, as we're seeing with these new variants, they're more virulent, they're just more contagious. And it's really, we're getting to the point in this thing where it's either get the vaccine or get the virus one way or the other. And I think, like we said before, like the known and the unknown, I know it's scary. It's scary to get a vaccine that's only been around a year at this point. It's scary to put something that you don't, necessarily fully understand into your body when you're pregnant. It is, yes, it is anxiety provoking for many people, and I completely understand that. But think about what we do know. And what we do know is just how bad this virus can be for both you and your baby. And Dr. Matthew and I, like we all three of Catherine and I, we can all agree and we all understand going through this process because we've all been pregnant and been there with you. And I might not be your doctor, we might not have a long relationship, but please know more than anything in the world, I love my daughter, I love my kids, and I would never do anything to risk harming her. And I would only do what I can to protect her. So that is what kind of changed this whole conversation for a lot of us, is we do this to protect them, even though I think the act of doing it is scary. Absolutely.
That was very well said, and I think a perfect way to wrap up tonight. So thank you to all of our panelists, and thank you to everybody who is participating. I did put a few links in the chat where if you want more information, CDC and ACOG are in there. You can email us at brhealthdistrict@gmail.com. We are happy to answer your questions. We can contact providers to help answer them. And then I definitely recommend that anyone who has questions contact your provider directly. As you can see, the local doctors here from UVA are more than happy to talk about this. We want to give you the best information you can to make an educated choice to hopefully get vaccinated, and we're here to support you. So thank you all. I think we will wrap up from here. Anybody else have any final words to say? We're good to go. Okay, great. Well, thank you all for taking time out of your night to come. We appreciate it. And again, if you have questions, please let us know. But I think this was a great conversation, and we're more than happy to help answer more, and hope you all get vaccinated. Take care.
Thank you. Good night.
Have a good night, everyone.